April is National Minority Health Month. We recently recognized Black Maternal Health Week. It is a time to raise awareness about health disparities that continue to affect minorities, especially Black women.
Yeah, a local women's health nurse practitioner, Dr. Shawana Moore, knows this as a healthcare provider, and she has her own story to tell. Quite the story. Dr. Moore's family has a history of preeclampsia, a pregnancy-related complication involving high blood pressure. She told her health care providers about her concerns while pregnant, but they brushed it off and told her, "You'll be fine." Well, that was not the case. When Dr. Moore was 38 weeks pregnant, she went in for an OB visit, and her doctor diagnosed her with severe preeclampsia. She was sent straight to the delivery room to give birth to her son, Emery. Dr. Moore stayed in the hospital after giving birth, but she felt like she was being ignored. Her care did eventually improve, thanks to the help of a former student of hers who happened to work on the unit advocating for her. Now, through the work of her organization, Dr. Moore is highlighting the importance of nurse practitioners in advocating for Black maternal health. And Dr. Moore is sitting right next to us now. Hi.
Good morning.
Hi, good morning. Thank you for having me.
Chair of the National Association of Nurse Practitioners in Women's Health. Thank you for coming in.
Thank you for having me.
Did I get all that right?
You did.
Whew.
Quite a few titles to hold.
Yeah. I know. But somebody you knew was on that unit.
Yes. So
Thank God for her.
Yes, she is very near and dear to my heart, and I had the pleasure of teaching her. So it's my hope that all the students that I prepare as women's health nurse practitioners learn to care to all women, regardless of their ethnicity, their socioeconomic status, through a lens of equity. And she proved to me that day that what we teach in a classroom and in clinical does translate to clinical practice.
She proved that you're a good teacher, too.
She did.
Yeah.
And we hear the term implicit bias in so many different definitions here. How do you define implicit bias when it comes to healthcare?
Sure. So the biggest thing about implicit bias is all of us have it, regardless of what profession we're in. And it's not necessarily something to frown upon. It's something to embrace and to address and know that we all carry it. But the biggest thing is, how do we address it? So implicit biases are things that we aren't aware of, that we may have learned over time. And that's the beauty of it. Because we've learned it over time, we can unlearn it. But I think the biggest thing is having an awareness of it and not to shun away from it and not to be embarrassed by it, because we all carry some form of implicit bias.
But you've got to realize that you are biased to learn, don't you?
Absolutely. The first thing is acknowledgement. So being able to accept that acknowledgement and awareness that you do carry implicit bias.
Do you think we all carry it, though?
We do. Every last one of us carry implicit bias.
Even though we, for sure we don't. We do.
Well, I think we need to kind of re-examine ourselves.
Yeah.
Does this come down to, though, just listening? I mean, a lot of these women, especially Black women, just aren't being heard.
Very true. And I wrote an article about respectful care more recently and the voice of the patients. And I encourage patients to advocate for themselves by using their voices. But it's even more important for healthcare providers and community stakeholders to listen to those voices. So when women are using their voices and are advocating for themselves, it's important as a community of healthcare professionals to make sure we are listening and validating their voices.
You know this firsthand. You were there. You're laying in the hospital. You weren't being heard.
I was not being heard. It was my student, my former student, who actually made sure my voice was amplified. Because of implicit biases that some of the healthcare providers may have had on that unit, my voice wasn't taken seriously.
You weren't feeling well. No one was checking in on you.
Absolutely. Bells and whistles were going off. My husband, he looked very shocked and afraid, to not knowing what was going on. Nobody came into the room. So
I think we've all had experience with that a little bit.
sure.
And you're a doctor and not getting help.
Yeah, and the biggest thing as a women's health nurse practitioner, docs really prepare. I don't try to lead that way in healthcare because it's my hope that regardless of what I look like, what title I have, what education I have, you'll care for me just as you'll care for any other person. That's the care that I provide to my patients, and that's the hope that I hope that other healthcare providers use that same lens.
You would hope so. I feel like we've been talking about this for far too long. Are we headed in the right direction?
I think we are. I think the biggest thing it starts with within an academic setting, right, and within specific healthcare professions like women's health nurse practitioners, right. So we make sure within an academic setting that we include continuous professional development around implicit biases, and not just implicit biases, but microaggressions and other topic areas that really historically impact marginalized communities of people.
So you don't think it's been addressed in past years at medical schools?
I can't say it has not. I would probably say not in the way that it should have been as a continuous implementation within curriculum.
Thank you for what you're doing.
Real quick, do you think you need to hold your colleagues accountable, the nurses, nurse practitioners, doctors, just to say, hey, wait a minute, you need to take a step back.
Absolutely.
You're not providing the care you should.
Absolutely. I think we all have to hold our colleagues accountable. I think that's essential to addressing the problem.
Well, thank you for what you're doing.
Thank you.
Leading the charge here.
Yeah, and the other thing I just want to say, as the chair of the National Association of Nurse Practitioners in Women's Health, we are really leading the conversation around addressing Black maternal health. We were sponsors for this past month of Black Maternal Health Week, and we are making sure our women's health nurse practitioners, as well as other advanced practice providers, are properly educated to actually prepare to care for diverse populations of women.
Thank you for what you're doing.
Keep the conversation going.
Your son is 5 now, Emery?
Emery's 5.
He's doing well?
He is doing exceptionally well.
Excellent.
Thank you.
He has a good mom.
Thank you.
There he is. He's 5.